Thank you, Premier, and good morning, everyone. There were 390 locally acquired cases of COVID-19 reported in New South Wales to 8 p.m. last night, and one overseas case. There were almost 130,000 tests reported to 8 p.m. last night. So again, a big thank you to all the community for coming out to get tested. And again, an all-important reminder that even with the mildest of symptoms, we ask you to please come forward to get tested and continue to do so in the great numbers that you are. In terms of COVID-19 cases in hospital, there are currently 391 cases admitted to hospital, 63 cases are in intensive care, and 30 require ventilation. Of the 63 in ICU, 4 are in their 20s, 6 are in their 30s, 5 in their 40s, and 15 are in their 50s. And I just want to emphasise, I guess, again to people, the importance, particularly for young people in our community. With this Delta variant, we are seeing a large number of younger adults being affected by COVID-19. In the last 14 days, that 20 to 29-year-old age group we have seen being the biggest numbers. And so I just want to particularly encourage younger adults in our community to please take the stay-at-home orders in the Greater Sydney area as seriously as you possibly can. Please follow the advice, please get tested, please get vaccinated. Of the 63 people who are in ICU, 55 are not vaccinated. As the Premier mentioned, we're very sad to be notified that 2 cases of COVID diagnosed died overnight. The first is a man in his late 90s from Newcastle who died at Hawkins Masonic Village in Edgeworth. He had acquired his infection recently as part of the outbreak in the facility. He had received 2 doses of vaccine, and our heartfelt sympathies go out to that family at this time. The second death notified was a woman in her 40s who died at home in southwestern Sydney. She was a close contact of another confirmed case. She tested positive on August 7th and was unvaccinated, and the local health district will be investigating her death and also be referring it to the coroner. And again, our sincere, heartfelt condolences to her family. I'd like to provide a brief update on Western New South Wales. Overnight, we had 10 new cases identified in the Western New South Wales Local Health District, the majority being in Dubbo and 2 in Walgett. It is an evolving situation in Western New South Wales that we are carefully monitoring, and we do expect to see some further cases emerge. In the sewage detection, there has been COVID-19 detected in the Bathurst region, Parkes and Burke. And so we encourage all the community in Western New South Wales to please note the stay-at-home orders, stay within your household, don't go out only for reasonable excuses. Please seek testing and please get vaccinated as soon as you have an opportunity to do so. In Hunter, New England, there were 5 cases notified overnight. 1 is an additional case associated with the residential aged care facility, and the 4 other cases are those linked to previously reported cases. And finally, just to emphasise, as the Premier did earlier, we'd like to encourage people who live in the Blacktown area and Mount Druitt area as well to please follow the stay-at-home order and please come forward for testing if you have even the mildest of symptoms. Thank you.